She's suffering from partial paralysis. That accounts for the apparent lack of pain, called out Dr. Bartonelli. I'd do a quick neural assessment, test the response to pressure and pain. Cobra Dillon nodded her head as she looked at the general surgeon, who was very vocal at the M&M conference. You solved half of the equation. The patient does have nerve damage, the 7th cranial nerve to be exact. That affects the facial expression, yelled out an intern who was finally able to contribute a piece of information to the medical puzzle. If the nerve is weak, there can be no facial expression. Go on, Dr. Roberts, continue. Did the injury occur as a result of the broken arm, or was it a pre-existing condition? Asked Dr. Cobra Dillon. The intern considered the question and then went with a hunch. It was a condition she was born with. Are you making a statement, or are you asking me a question? It's a statement, he said, looking around the room for assistance. Dr. Ileana Martinez broke into the discussion. Mobius syndrome is a congenital birth defect affecting the 6th and the 7th cranial nerve. It restricts lateral eye movement, and patients present with weakened facial muscles. A first-year resident dismissed the diagnosis. That would have been detected by a pediatrician long before this accident. It would have come out in her medical history. The young physician paused before continuing his train of thought. What about frozen watching? The girl could be a victim of child abuse, which would account for the lack of facial expression, and she could also have a high tolerance for pain. Most children of physical abuse have the frozen look. They say nothing, but observe everything around them. Cobra acknowledged what the resident said. It is not frozen watching, but that's a good guess, Paul. The girl isn't a victim of child abuse. She comes from a loving foster family. The tiny surgeon continued speaking as she nodded towards Dr. Martinez. You are right, Ileana. You've got it. She has Mobius syndrome. It wasn't diagnosed at birth because the teen didn't have a permanent home. Most people simply assumed she was retarded. Good call. Dr. Aaron Simpkins leaned against the back wall and absorbed the details being discussed. She frowned as she listened. The group had not come up with a reason for the young girl's high tolerance to pain. The 2 damaged cranial nerves did not account for her lack of pain. Was she suffering from some neurogenic shock? That sounded possible. The cardiothoracic surgeon raised her hand slightly to gain attention and spoke. During the wrestling match, did the girl suffer any type of spinal cord injury? No. The patient was able to move her left arm and both legs. She had no trouble sitting up and walking. What about another congenital defect? An insensitivity to pain? Suppose she can't feel anything. 2 congenital defects in one patient? It's possible, stated Dr. Bartonelli. Congenital analgesia? Shouted out Aaron Simpkins. That would explain so many things. Congratulations, said Cobra Dillon. I am truly impressed with your diagnostic skills, doctors. The patient has Mobius syndrome, which was not diagnosed at the age of 13. The patient was also born with a condition that did not allow her to feel physical pain. And the plastic surgeon said this in her rich Tennessee accent. Her sparkling blue eyes lit up as she surveyed the conference room. You guys are excellent. It took me far longer to diagnose that patient and a whole load of tests that had to be run in order to prove it. Dr. Bartonelli paid tribute to the tiny doctor. That CPC has been challenging. Good work, Cobra. Interesting presentation. Yeah, Doc, yo. Fascinating case. What happened to the girl? Asked the black surgeon, Walter Dickerson. She was treated in the ER and then referred to a specialist. Great catch, Dr. Dillon. That patient was fortunate to have you as a doctor. Erin expressed similar feelings from the back of the conference room. She too agreed that today's conference had been stimulating and rewarding. Cobra Dillon smiled as she accepted the praises being given out. She once again realized that this was definitely the hospital she wanted to work for. Despite such ethnic diversity, the surgeon and the physicians here were superior. They had solved the medical guessing exercise in a reasonable amount of time with limited information. These were her peers, and she was proud of them.